Good morning, Miss Mridu Gupta.
Good morning, ma'am.
Ma'am, you are on mute.
Ma'am, you are on mute.
Okay, sorry. Good morning. I know I'm a little early, but I just thought I'd check the sound and the video and all before we get started. Are we looking at starting now?
Ma'am, we'll start sharp at 11:05. We'll wait for some more participants to
11:05.
join
Okay, okay.
because it is the time of their class to end. So maybe that's why people are getting late in joining. We can wait for
Yeah, no
5
problem.
more. Thank you so much, ma'am.
Thank you. Till then, maybe we can chat. I can see a lot of backgrounds with the red ribbon. Is that for AIDS or is that something else you all are promoting? Anybody with the red ribbon background? Okay.
Ma'am, the 4th of February is marked as National Cancer
Yeah.
Day. So for that, we have this background.
Oh, you have the background for Cancer Day. Okay, the red
Yes,
ribbon
ma'am.
usually they use for AIDS, HIV
Ma'am,
also. So,
yeah, and it is also
Yes,
used for cancer
okay. Yeah,
awareness. So that's why.
correct.
Good morning, all. Good morning, Dr.
Good morning.
Mradula. Good morning, and welcome, Dr. Mradula.
Good morning.
With
Yeah,
so Ma'am Daya ma'am is our convener of our society.
Okay. Good morning there.
good morning. I'm sorry to join late because I was having another class from 11. So I just gave a short break to welcome you.
Okay. I was told that there was another class and they were looking to wait.
Yes, actually, the class schedule is from 9 to 10 and 10 to 11. So most of the time, if we are starting at 11 o'clock, so student take 5 to 10 minutes to join.
Correct, correct. Understood. That makes absolute sense. No
Yeah.
problem.
Yeah. Priya, I think 81 has joined. We may start if ma'am is I think she is having. Uh, why to make her wait, or you want to wait for the students to join?
Ma'am, we are waiting till 11:05. So yeah, it is
Oh,
11:05 now. So we
yeah.
can start. Yeah.
Yes. Yes.
Okay. So anchors, please start with the show.
am I on? A very good morning to one and all present here today. I, Sanchita Bansal, the member of event management team, want to
And I,
welcome you
Ankita,
guys. Yeah.
and I, Ankita Prakash, member of Event Management Team, welcome you all to the today's webinar organized on menstrual hygiene and cervical cancer.
Here, here are few instructions for a better visual experience of the event. Please keep yourselves on mute during the meeting. Join from laptop for a better visual experience. Please avoid presenting your screen to maintain the decorum of the event. You are requested to preferably keep your videos enabled throughout the session to make it interactive.
Before we begin, I would like to acquaint you with our beautiful organization, which is Menstrual Cafe of our college. Menstrual Cafe, Shahid Rajguru College, is a campus ambassador program for students in educational institution wherein they engage in a dialogue and activities with the aim to dismantle stigma and generate awareness around menstrual health and hygiene, sexual and reproductive health rights, and mental health. We would like to present our heartfelt gratitude to our respected Principal Ma'am, Professor Dr. Payal Mago, for initiating this beautiful organization in our college. In our 6 months of establishment, we have been able to conduct impressively grand events with many tycoons of various fields. This includes renowned national cybersecurity expert, Mr. Rakshit Tandon, ace gynecologist, Ms. Hima Ranka, eminent psychiatrist, Chainika Chaudhary, Ms. Vitika Yadav, founder of the noted Instagram page named Love Matters India, knowledgeable professor, Dr. Chanvi, and noteworthy lawyer, Mr. Advitya Grover. We have successfully inaugurated and installed a state of the art pad vending machine and incinerator in our college. Moreover, we have triumphantly conducted our 15-day long annual fest named Avta, which means freedom. We are delighted to inform you that our first ever fest turned out to be a roaring success. We hope to keep up the good work and go and do our bit to change the lens with the menstruation is viewed in society.
Now, I would like to extend a very warm welcome to our special guest, Dr. Payal Mago. Dr. Mago is the principal of Shahid Rajguru College of Applied Sciences for Women, University of Delhi. Ma'am has always backed us and has always led us in the right direction and has ensured the constant growth for all the students. Today, she is not able to join due to her prior work commitments. Can we proceed further? I would like to welcome Dr. Daya Bharadwaj, convener of Menstrual Cafe of our college. Ma'am has always backed us and has always led us in the direction and has ensured the constant growth for all the students. I would request Daya ma'am to kindly share a few words for wisdom to the audience members.
Good morning, all. I heartily welcome Dr. Mradula, and I know that this Menstrual Cafe of our college, the whole team is working hard to bring some topics which are of main concern in the society. We are working towards raising the awareness among the students of our college. And during this, students are organizing various events. And we all know that regarding their menstruation, these students, or basically the girls, they are not aware. I should not be talking about the girls from the underprivileged class. Even the middle class and the high income group girls, they are also not aware of many things related to the personal hygiene and the menstrual hygiene. I myself has two daughters, and I came across when they started their periods, they are very much reluctant about the personal hygiene. I have to teach them that this is a body part, this is your body part, and it's not different from other body parts. You have to maintain the hygiene. So I have to teach them, and they were very scared. Like during the, it's a personal experience, but I just wanted to share with you. My elder daughter, she was so much afraid during the menstrual period time that she was not able to take the bath. Like she was not ready to take the bath. She was having hesitation. And I used to say, ki, you have to take the bath. No, mama, I won't take the bath. I'm not feeling very comfortable by my periods. So then I have to teach her that, yes, this is a very, very important thing. You have to maintain your hygiene. And then I taught her that it is not only the hygiene, it may lead to many other problems with this particular problem. If you are not maintaining hygiene, later on, you may develop different diseases. So then I have to tell her about the cancer, cervical cancer, and other problems. So I feel that student, they chose a very, very good topic for today's webinar, and I hope that ma'am is with us. and she's from the medical background. We are not from the medical background, so we can just teach whatever information is available from our elders or maybe from the Google. But now we can share we can just, if we have any query, we can ask ma'am and she will give us the real facts. And I welcome ma'am to the webinar. Thank you very much for joining us.
Thank you there. That was such a lovely
Thank you. Thank you for your enlightening words, ma'am. Now, I would like to brief you people about today's topic of discussion, which is menstrual hygiene and cervical cancer. Menstrual hygiene is a hygiene practice during menstruation which can prevent women from the infection in reproductive and urinary tract, ultimately protecting them from reproductive tract infections, RTIs. Whereas cervical cancer is a malignant tumor of the cervix, the lowermost part of the uterus. If detected at the right time, cervical cancer can be treated through surgeries, radiation, and chemotherapy.
I would like to take this opportunity to introduce our eminent and multifaceted speaker for today, Ms. Mridu Gupta. She is an experienced Ayurveda and lifestyle consultant having a clinical experience of over 12 years. Ms. Gupta practices Ayurveda through the pulse diagnosis, Nadi Priksha, therapeutic yoga, diet, and lifestyle management. She has specializations in gastro, gynecology, hair, skin, ortho, etc.
We extend a very warm welcome and heartiest welcome to ma'am. As rightly quoted by Verena Devine, early detection is the best prevention. Now, I would like to extend a warm welcome to Ms. Mritu Gupta, who has constantly been working hard to bring about efficient changes in the development sector with her motive of boosting the status quotient and bringing about the necessary growth. She has been constantly towards creating awareness of women-centered cancers such as cervical cancer. We welcome ma'am today to share with us her experience and analysis of the awareness and the work that she does today to help women take action regarding their health.
Thank you so much. Thank you, Team Menstrual Cafe. I mean, this is a wonderful initiative that you all have started, and it's a lot of work that I see you've done in the last few months. So that's really commendable. And this is definitely a very important topic to be talking about. So a lot that you have said about cervical cancer is right, but I think the intro of mine that you have given is not my intro. You've picked it up from another Mridu Gupta of some kind. I don't do Ayurveda and the rest of it. So maybe I don't think you've gotten the right intro, but I've been in the development sector for the last 25 years, and we have been working on cervical cancer under CAPID, Cancer Awareness, Prevention and Early Detection Trust, for the last 8 years. So I would want that all of you keep your videos on, because we would want this to be interactive. And before we get started, I want to know how many of you had even heard of cervical cancer before this talk was introduced to you. How many of you were aware of cervical cancer? You want to put it on the chat? The ones who were aware? Because even if you were aware of cervical cancer, good. I am going to today run through this entire information on cervical cancer and tell me how much of it is new to you and how much of it you had already heard, right?
Only heard, don't know about it as such.
Sorry? I'm happy to see. Okay, I'm not being able to hear. Did somebody say something?
Ma'am, many of us didn't know. Actually, very few people know.
That's true. I can understand that. It's not something we talk about. So that brings me to my first point. Why did we choose to talk about cervical cancer? Why do we have an organization that's working on cervical cancer? Right? And why am I so happy to be speaking to the youth about cervical cancer? Cervical cancer, I will go into details now, but India carries 1/4 of the world's burden of cervical cancer deaths. 1/4 of the total amount of deaths in the world come from India, right? The West has as good as eliminated the developed countries have as good as eliminated cervical cancer. Therefore, they are not going to make too much of a noise about cervical cancer. This is largely our problem. And we have to make a noise about it. And the only ones who are going to take this conversation forward is the youth. The youth have to know about cervical cancer. They have to be able to prevent cervical cancer in their own lives and help others prevent cervical cancer. Nobody else can do it. And nobody is coming from outside. It's not like breast cancer where the entire world is working to eliminate breast cancer or make you aware of breast cancer. There is so much information you get from the developed countries on breast cancer because it is their largest cancer. Cervical cancer is ours. So we need all of you to get into this conversation so that we can. The second reason we need youth is, I don't know whether you know it or not, but cervical cancer is a sexually transmitted infection, right? You do not expect women of my age to be going around talking about sexually transmitted infections. We are not still comfortable doing that. But the youth, they find it easier to talk about sexual diseases and, preventions and things like that. So because you will be able to take this forward and talk about it openly, you need to be well informed about it. Correct? The reason why we haven't been able to eliminate it is because we don't talk about it. We don't, even AIDS, we were one of the last countries to move AIDS forward because we weren't willing to open up and talk about it openly. Like your Dr. Daya was saying. She was saying that y'all are hesitant to talk about it. She had to actually tell you all things about it, which is exactly how it was even with AIDS. But let's not do that for cervical cancer. We've lost enough women on cervical cancer. So let's get talking about it. Okay? So that's the reason why we as an organization have chosen to work with cervical cancer. Because it is an India-centric problem, we have to make the noise. Because it is a sexually transmitted infection, and we have to start talking about it. Right? Those are a few of our reasons. And also the fact that it is a preventable disease. It is a 100% preventable disease. And yet, when we do the stats, I will tell you, we lose one woman every 8 minutes to the disease in India. That is what a waste of life it is. Something that you could completely prevent, you're losing one woman every 8 minutes. Does that seem fair? So that kind of a waste is what we can actually stop, right? So while I will explain to you in detail what it is and then tell me what is new in your knowledge now on cervical cancer after I finish, and then we'll see how we can take it forward from here, right? So can I share my screen? Okay, so I'm going to give you a little bit about who we are. We are Cancer Awareness, Prevention and Early Detection and what we do in the field. I will share with you a few case studies and who we are, and then we'll go into what cervical cancer is. Okay, now I'm a little bit dodgy when it comes to technical issues. So agar time lagega for me to get the video up, just give me some grace. Okay? Okay, what do I have to do in this? A window, a tab, what do I open? Best for video and animation.
You can use a tab if in case the tab is whatever screen you are sharing is a Google Chrome screen, or else you can go for a window.
A window then. Okay. So I will have to do a window. So 1 minute. That means I will need to. Okay. Tell me if you can hear, okay? Can you hear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
We set up in May of 2014 and we started tentatively with awareness workshops. We did workshops at corporates, schools, institutions, townships, a lot of places to spread awareness. Slowly we graduated with the help of Indian Cancer Society to do screening. We started with busties and a few women. Random screening camps. We learned policy issues. We learned about what's happening in the field and what really was required in the field by us.
मेरा नाम लक्ष्मी है जी, रजौकरी की मैं रहने वाली हूँ। हमारे रजौकरी गांव में कोई चीज की सुविधा नहीं है जी। हमको बहुत दूर इलाज कराने के लिए हम जाते हैं, हमको बहुत दिक्कत पड़ती है जी। यहाँ पे कैंप लगा था, गाड़ी आई है, आप फ्री में इलाज हो रहा है, टेस्ट हो रहा है फ्री में। तो मुझे भी पता चली, तब मैं भी दौड़ के गई। मैंने जाके मैम दिखाया तो मेरा टेस्ट करा कि मेरे बीमारी बता दी कि आपके तो कोई कैंसर वगैरह भी हो सकती है, आपके शरीर के अंदर बीमारी है। तो मैं भी शर्मारी थी कि मैं तो ऐसा नहीं करवाऊं। फिर मैं सीधी हुई पे सफदरजंग मेडिकल पे गई थी। 5-6 डॉक्टर ने मेरा जांच करा था, उनने मेरा दिक्कत बताई। हम आपको इलाज पूरा कराएंगे, इसमें ज्यादा समय नहीं लगती। टाइम से इलाज करा लेंगे, टाइम से चेकअप करा लेंगे, तुम्हारे कोई परेशानी दिक्कत नहीं पड़ेगी। अब मैंने अपना इलाज करा लिया था, मैं पूरा काम अपने घर की गृहस्थी संभालती हूँ। तो ये कैंप लगना इतना जरूरी है। जिसी माई बहनी के दिक्कत है तो इन्हीं कैंप लगने पे जो भी नहीं अपना टेस्ट करा रही है वो भी करा रही है। डरे मैं भी थी और शर्म मुझको भी लगेगी, लेकिन अब आप शर्म करोगी, थोड़ा डर करोगी तो अपना इलाज करा नहीं पाओगी। इलाज करवाना बहुत जरूरी है, और इलाज नहीं कराओगे तो आपकी जान भी जाएगी। आपको अंदर थोड़ी बीमारी है, उसको ज्यादा भी फैलेगी। शर्म की जगह शर्म करो, लेकिन बीमारी के अंदर कोई शर्म मत करो। मेरा नाम जगवती है, मैं अरोड़ा गांव से हूँ। सर्वाइकल कैंसर, उसकी रोकथाम के लिए हमारी ट्रेनिंग हुई थी, जिसमें बताया गया था 10 साल के बाद में, शादी से पहले में एक इंजेक्शन लगता है, हम अपनी बेटियों में उनको लगवा सकते हैं। जो ये कैंसर है, इसी को अगर हम बार बार जांच कराते रहेंगे तो इसे पहले ही फर्स्ट स्टेज में अगर पता चल जाए तो हम उसका इलाज आसानी से कर सकते हैं। जो लेडीज हैं, गांव की लेडीज हैं, वो हॉस्पिटल तक नहीं जाती, अपने मन की बात है जो वो नहीं बता पाती। हॉस्पिटल वहां तक नहीं जा रहा, मतलब बंदा में पेशेंट है जो हॉस्पिटल तक नहीं जा रहा, तो उस हॉस्पिटल तक को बंदे तक पहुंचना चाहिए। हेलो, है कोई बात नहीं, एक बार आ रही हूँ। कभी ऐसा भी होता था कि कोई लेडीज मीटिंग में नहीं पहुंच पाई होती है, तो फिर हम एक एक करके हर घर में वो वहाँ जाते थे और लेडीजों को सब बात समझाते थे, बताते थे उसके कि कैंसर क्या है, सर्विकल कैंसर क्या है। पहले तो ये था कि जी दरवाजा बंद कर लेती थी लेडीज, नहीं सुनती थी, पता नहीं कैसे क्या समझा रहे हैं, क्या बोल रही है सबके सामने, तो ऐसे बोलती थी। पर अब ये चीज नहीं है, अब तो कोई भी लेडीज आती है, आराम से पूछती है कि भाई ये टेस्ट कब हो।
After 3 years of working in the field and consolidating, we decided on taking the big leap. We introduced theatre for cause. We wanted to reach many more homes, dads, husbands, brothers, wives, sisters, to create awareness about cervical cancer, that it is preventable.
For this campaign to be a success, of course, a big thank you to all those who have brought us to this point. But from here on, we need a lot more. We need a lot more people to join us. We need supporters, volunteers, collaborators,
people who back us, who work with us, and helping us in making our dream come true. So thank you to everybody who's part of our journey and who continue to support us. And let's make cervical cancer Mukt Bharat. Thank you, and thank you for all your support.
Cervical Cancer Mukt Bharat, an initiative by Capitania.
Could you all see the video?
Yes, ma'am.
Yes, ma'am.
Okay. So that's what we do. That is who we are, and that is the work we do in the field. We create awareness like we are doing with you. We also do screening for the economically weaker section. So we take our mobile van and we screen them right there. Those are the screening camps that we do. Because in our country, access and availability to screening is not available at the last mile. So we can create awareness in villages, but what will those women do? Where will they go to get screened? So we try and do that, and we are also working with the government to create some kind of screening module at the last mile, at PHC, CHC level. So that is how we work. Now, I'm going to share a presentation with you, but before we get into cervical cancer, I want to know what you think about cancer. When you say the word cancer, what comes to mind? How do you feel? What does the word cancer bring to you?
This is a life-taking.
Okay, life-threatening, absolutely. That's one of the first things that hit us. What else? A tumor. Okay.
Mom, cancer, it has a word can, C-A-N. We can prevent it. If we can, if we do it accordingly, if we treat ourselves, if we do the things that are required for it.
Okay. Emotional battle, yes. Okay. So while you're right, that uncontrollable division of cells, absolutely. So we'll just run through a little bit about what cancer is. But the thing is that the minute somebody says that, there's cancer in my family, or I have cancer, or somebody has cancer, immediately we get this feeling of dread, like, oh no, poor thing. Or, it's like so sad. Or we have all of this. And yes, from your head to your feet, there are 205 different types of cancers you can have. There can be any kind of cancer of any part of the body at any time, at any age, in any country. So cancer is this, it's all over the place. But almost all cancers can be managed if caught early. And we are going to run through a few early signs of cancer, right? So when you say that, yes, cancer has can and we can, yes, we can. But we need to know what we are supposed to do to be able to do that. How do we prevent it? How do we catch it early? What are we supposed to do? That is something you need to know. So while you know that I can handle it, it doesn't mean that you can handle it just because you want to. You have to have the skills to do it. Okay? Okay, again, I am going to try and pull out my presentation and share that with you. A window, okay. Here we go. Tell me if you can see. Have we got?
Yes, ma'am.
Yes,
Yes, ma'am. Yes, ma'am.
So what does cancer mean to you? You have given me what it means to you. I'm going to tell you what it means for me. Cancer can affect people of all nationalities and age groups. It can happen anywhere, everywhere. Let's not say that this is a Western. In the West, we have this disease, and in India, we have more. The only reason cervical cancer is more in India is because we haven't done anything about it. It doesn't mean that it affects Indians or any kind of a nationality. No, that's not what happens, right? So now, how will you detect cancer early? Almost all cancers can be treated if detected early. How do you catch them early? Now, for general cancer, this is not for cervical cancer. This can be for multiple types of cancers. Okay? 7. There are 7 thumb rules for cancer. If there is any change in your bladder habits, your bowel habits, I mean, if you're constipated all the time, lose motions again and again for over 6 weeks, it crosses 6 weeks. Like you have loose motions, you take your tablet, you're okay. And then in 2 weeks, you're back again. You've taken an antibiotic, you clear the loose motions or whatever, the constipation, and then it comes back again. If it happens repeatedly, you need to see a doctor, right? If you have a wound or a sore, as they call it, a wound that does not heal, please see a doctor. It could be diabetes, could be anything, but it's better to see a doctor. If there is any unusual bleeding or discharge from any orifice in the body, right? Nose, mouth, ears, anus, vagina, anywhere in the body, it needs to be checked. Of course, वो नक्सीर आती है, we say कि गर्मी है तो आ गई. Once in a while, something like that happens, fine. But if you tend to find bleeding or discharge, that is abnormal, excessive, or smelly, please get it checked. Again, like a lot of you said, cancer is about a tumor. So any kind of thickening, any part of the body, any kind of a lump, have it checked. If any of this lasts for more than 6 weeks, you need to see a doctor. It could be nothing. It could turn out to be absolutely nothing, but it could be cancer. It's best to catch it early, right? If you have indigestion or you have difficulty swallowing. So if you can't gulp it down, yes, with Omicron, everybody seems to have a problem with their throat these days. Let's not get into that. But if it lasts beyond what it should, if you have constantly, you have indigestion and you have acid reflux and you have a feeling of being uncomfortable, needs to be checked by a doctor thoroughly. Okay? Any change, yes, Sare, we have these what we call beauty spots and birthmarks, and we are very happy with them, right? But if there is any change in size, color, shape, thickness, if there is any discharge from it, if there is any pain in it, any kind of change in these permanent marks, you need to see a doctor. Okay? If there is constant cough or hoarseness or change in your voice, you need to show it to a doctor. Also, if there is unexplained weight loss. These days, we are so happy with weight loss. And now COVID mein ghar mein baithe baithe, everyone's put on weight. So if you lose weight, everybody is so happy I've lost weight. But if you are not doing anything, if you have not changed your diet, if you're not exercising and you're losing weight, you need to see a doctor. Okay? These are just normal changes in our body. We may not even notice them. So it's for you to be self-aware and to know that this is happening to me over a longish period of time. It's gone on for over 6 weeks, 8 weeks. I need to see a doctor. Right? Let's hope nothing comes out of it, but it could be cancer. Right? So we are going to do a little bit of an understanding of what cancer is. Okay? Right. I have to do a window.
At the simplest level, cancer or cancer cells are cells that have lost the ability to follow the normal control that the body exerts on all cells. In our body, we have billions and billions of cells, and they have different functions. It's a very complicated process under incredibly phenomenal control. And if something goes wrong and that control is lost, then particular cells escape the normal control mechanisms, and they continue to grow, and they may spread. That's what we call cancer.
As those cells grow and divide, they turn into a mass, or they clump together, and that's what we would call a tumor. And then they can get smart and then spread other places, and that's what we call metastasis.
Cancer can actually occur anywhere in the body because there are cells everywhere in the body. In women, one of the most common cancers, of course, is breast cancer, and in men, prostate cancer. And in both men and women, lung cancer and colon cancer are common cancers.
Right. So that is what cancer is. And all of you have agreed that it's uncontrollable cell division and tumors is cancer. So what's so unique about cervical cancer? Cervical cancer is caused by a virus. A viral infection is what causes cervical cancer. Therefore, it is a sexually transmitted infection, right? What happens is that you have a virus in your body, and over time, it irritates the cells so much that the cells become cancerous. They start to divide, and all this explanation that he just gave you about cancer, that is what happens to the cells. So while other cells divide, we don't know why. We say there are carcinogens. If you smoke, that could be one of the reasons. There are various reasons for why cell division happens, abnormal cell division. It could be genetic, whatever. In cervical cancer, it is because of the virus, right? That is the difference about cervical cancer. Let's go back to my presentation, and now we will do on cervical cancer. again, I share with you my presentation. Right. What is cervical cancer? Do you know when we asked this question in a survey across 21 cities in the country, about 23% people told us that it is a cancer related to the neck. They thought it was the cervical, which is the back of the neck. That is how much awareness there is of cervical cancer in our country. So what is cervical cancer? Where is the cervix? Yes, this is also a joint. So this is also the cervical. Cervix is the mouth of the uterus. It is just that point which is the mouth of the uterus. It's a small little part of the body, and yet when it gets cancerous, we lose women with it. And it is so deep in the body that it's not something that you can see or you know about it. Therefore, you have to just be preventive about it. The fact that it is a virus is the reason why it can be prevented, and we'll study how we can prevent it. So where is the cervix? It's the mouth of the uterus. And somebody, when they introduced us, they told us that it is a, this is the Menstrual Cafe and they're talking about menstrual hygiene and cervical cancer, you know that it's part of the female reproductive system, but not everybody knows. So when you talk about cervical cancer to anybody else, first please check if they even know what the cervix is and where the cervix is. Okay? What are the causes of cervical cancer? 99.7 cases. This is just the scientific way of not saying 100%. Okay? 99.7% cases of cervical cancer are caused by HPV. What is HPV? It is the human papilloma virus. Okay? It is a virus. Just like corona and all the noise we make about corona now, similarly, this is also a virus. The HPV virus, you have HPV DNA testing, you have HPV vaccines. HPV is the word you've got to remember. And HPV causes multiple cancers. Not only cervical cancer. 100% of cervical cancer we say is HPV, but the HPV virus does cause other cancers. It doesn't cause death in the other cancers as much as it causes in cervical cancer, but vulvar cancer, vaginal cancer, anal cancer, mouth, head and neck cancers, penile cancers, all of them are, part of them can also be caused by HPV. There are other reasons to have head and neck cancer, chewing tobacco, other kinds of reasons for a head and neck cancer, or a vaginal or an anal or a penile. Part of it could also be an HPV infection, right? But for cervical cancer, all of it is because of an HPV infection. So now if you look at this, you will see how much HPV exists. 660 million people are infected with HPV each year. But 570,000 will be diagnosed with HPV-related cancer, which means that all HPV infections do not become cancer. Just because you have an HPV infection, it will not become cancer. But some of them will. Why will they convert to cancer and how will they convert to cancer? We'll do later. But what needs to be understood is that HPV is an infection that exists all over. It needn't become cancer. If you look at the last stat, it says number of treatment options for HPV infection, 0. There are no treatments for the virus. Just like COVID, you have to take a vaccination to prevent it. And if you get it, you will take medicines for the symptoms. Tum bukhar ke liye loge, khansi ke liye loge, zukam ke liye loge, but you will not take for the COVID virus. There is no treatment for the virus. Therefore, take a vaccine so that you prevent the virus, which is what we do for almost all viral infections, right? What does that mean for us? This is our stats when we say that HPV infection does not necessarily cause cancer, and yet 200 women die every day in India. We're talking about India. And if you look at this diagram, you will see India has the largest burden of cervical cancer deaths. And these are the countries that still have cervical cancer. The others are below the critical point. It says a lot for where we are and how much work we need to do on this, right? And once we had a pathologist from the US, she was doing a talk with us. And she said in her hospital in the US, wherever she was working, they had a slide of a cervical cancer case. It was a positive cervical cancer case. She's saying the slide went to every department to show the young doctors what cervical cancer looks like, what a cervical cancer cell looks like. She's saying they haven't even seen a cervical cancer cell. And she says, since I've come to India and started working here, every day I have like 5 or 6 slides that come up that are positive for cervical cancer. She's saying in the US, it is so rare that the younger generation of doctors haven't even seen what it looks like under a microscope. They have only read about it. But in India, it's rampant. So for her, it was like something new that she was seeing, that it was so much. She couldn't believe that it was actually what everybody talks about. So now we're talking about warning signs of cervical cancer, which means that you have an HPV infection and it has converted to cancer. And then you will start to get these signs. Okay? But these signs are just normal signs. You will have an unusual vaginal discharge, which means that what is unusual? It would either be excessive or it will be foul smelling, the discharge. Abnormal bleeding, right? Or you will have bleeding in between your periods or bleeding immediately after intercourse, things like that. It would be abnormal bleeding. Your menstrual cycle changes. You have heavier cycle or you have a longer cycle. Now, the problem with this is when we go into the field and we speak to women, they've had heavy bleeding and abnormal menstrual cycles. But, they talk to friends and everybody will say, "Arey, meri saas ka to bahut hota hai, usko to bahut dard hoti hai, uski to bahut bleeding hoti hai." And somebody will say, "Meri behan ka bhi hota hai." You talk to each other and you feel, "Arey, theek hi hoga, mera bhi." It's not what anybody says. It's your own cycle. If your cycle is heavier or longer than it used to be, it needs to be checked. Please don't ask anybody else whether it's normal or not or what they go through. Only you and your cycle. It's your body. Okay? If there's any discomfort during urination or loss of bladder control, with age, it does come, but you need to get it checked. Any pain during intercourse or in between, immediately after intercourse, there's bleeding, anything like that, it needs to be checked. Fatigue, these days, so with COVID, we are like all the time, anyone who's had COVID has fatigue for a long period of time. But when cancer starts to set in, when your cells are dividing and creating it, there is this constant sense of tiredness. Okay, pain comes much ahead. This pain, unexplained weight loss, leg pain when it has moved into the bones is later in the stage. But these are all signs of cervical cancer. Now, if you look at it, an abnormal discharge or an abnormal cycle is something that we would skip. It's not very obvious. So you've got to be alert for these signs. These signs are not in your face kind of signs. It's not like you have a tumor and you can say, yes, this is what it is. It's not. Right? Okay. So I can't see the chat, but I'm going to ask you. We say not all cancer is pink. Which cancer is pink? You'll have to speak up because
Breast cancer?
Breast cancer is pink, yes. What is this color that we have in pink? It says not all cancer is pink. The pink is a particular color. What color is that? Does anybody know? Okay. This color is teal. T-E-A-L. It's a teal color. Teal is the color of cervical cancer. Everybody knows pink is the color of breast cancer. I mean, a large number of people know that. Again, like I was saying, there's a lot of awareness of breast cancer, which is wonderful. We've been able to do a lot for breast cancer. Now let's spread awareness of cervical cancer. So look at this color and get this color. Anytime in your life you see the color teal, it should remind you of cervical cancer. And every time it reminds you of cervical cancer, you should talk about cervical cancer. Talk about it to all the people around you. Immediately there, ask them if they know what is cervical cancer. Ask them, give them basic information about cervical cancer. So you should know about it. But this color teal should now stay with you. Look at it carefully. Okay, it's there in our logo also. The color teal is the color for cervical cancer. And we should make it as popular as the pink ribbon. Correct? So HPV as a virus is a sexually transmitted infection, which means that it moves from men to women and women to men. It may cause cervical cancer in women, and women die with cervical cancer, but men are as much a part of the story as women. So don't stop to say that I will only share it with women. Share it with boys, share it with men. They need to be aware too. They need to go home and make sure the women in their family are aware, right? So this is not something that is meant only for women. It is a shared problem, and we have to get men into the conversation. In outside world, men are equally there. I will talk to you about a vaccine that is there for cervical cancer. In countries that have eliminated cervical cancer, boys and girls are both given the vaccine. In India, we're still trying to get girls to take the vaccine. Okay, so it is a problem that exists right around, and men have to come into the conversation. So when you're sharing the information, please share it with whoever and anyone who is there. Now, HPV will convert to cancer. It will take from 1 to 10 years for it to become cancer. From 1 to 10 years, it will only be an infection and can be treated as an infection. It needn't become cancer. And despite having a 10-year gestation period, we are losing women every day to get to cervical cancer, which means that women don't go and get themselves checked, or don't go for a screening, don't go for a health checkup, even once after they've had children and whatever. So there is just no checkup, no way that we can even find out that they have HPV infection. It can be easily caught. And yet we lose so many women a year. And it has such a long period, between 1 to 10 years. So if you have HPV infection and you have good immunity and hygiene, you will wash off the infection naturally. Not all infection will convert to cancer. Okay, you will be able to wash off. So your nutrition is good, you have a strong immunity, your hygiene is good, you will wash off the HPV infection from your body. But if you don't, like we find in the economically weaker section, their hygiene is bad, they're using the common bathrooms, their hygiene is bad, their nutrition is bad, their immunity is low, therefore their infection converts to cancer faster. They don't have any health checkups, they have no access to any kind of screening. They're not going to go and see a doctor. Therefore, we find it more there. But it isn't that it affects only the poor women. No. Almost all women, they say about 72% of women will be exposed to HPV in their lifetime. Not all of them will get cancer. So if you are strong, if you are hygienic and you are healthy, you will wash off the infection naturally. It needn't convert to cancer. And even if it does, it can still be caught in the precancerous stage, which means that you need to be aware of it all the time. How do you prevent HPV? One is a vaccination. You've seen how we are all waiting for the COVID vaccine these days. Even cervical cancer has a vaccine. They've had a vaccine now for the last 12 years in the country, and yet we have less than 1% girls vaccinated. So girls between the age of 9 to 14, they have to take 2 doses. Right? You take 1 dose now, 1 within 6 months. Over the age of 14, WHO and, ideally till the age of 18, but in India it will go on till the age of 26 or before sexual debut. You have to take 3 doses. 1 today, 1 within 2 months of today, and the 3rd within 6 months of today. So all 3 doses within 6 months you have to finish of the vaccine. And the vaccine prevents 70% of the infection, which is a large amount. The rest of the world, boys and girls are vaccinated. That's how Australia has eliminated it. But for us, we are still trying to get girls to be vaccinated. Less than 1% of girls are vaccinated in the country because parents have to ask for the vaccination. They have to be told about it. Okay, 1 vaccine, 2 doses, you're protected against 6 types of cancers. Largely cervical cancer, but the others as well. Okay. The other thing that we do to catch HPV infection early or catch early cancer is a screening. What's a cervical cancer screening called? It's known as a Pap test. Now, WHO says the first test should be an HPV DNA test, which is the latest, most efficient, most effective test, though it is expensive in India. But if you take a pap test, you have to take it every 3 years. If you take an HPV test, HPV DNA test, you have to take it once in 5 years, right? These tests are taken only after you are sexually active, and the new guideline will say over the age of 30. Because till the age of 30, most women can wash off the infection. They have good immunity and they are still strong, right? It's after the age of 30 that their immunity begins to fall and their nutrition affects the body. So with time, we have realized that the ones below 30, it's too early, even if they do have an infection, to do any treatment for them. We prefer to work on women over the age of 30. So your PAP test or your HPV test over the age of 30 is the best way, is the best time to do it. Okay, after you're sexually active. Those are the guidelines. What is a PAP test? Even an HPV test is the same way. Like in COVID, they take a swab of your nose and your throat. Similarly, for cervical cancer, they take a swab of the cervix. Because the cervix is so deep in, it is an invasive. You have to go to the doctor, she'll take a speculum and she will take the swab from the cervix. The point is that we go to the field and we do PAP tests in our screening events. We sit in a camp from 9 o'clock to about 5:30 in the evening, and we do over 100. We've done up to 120 PAPs, which means that it takes less than 10 minutes. Less than 10 minutes, once in 3 years, and you will be cervical cancer free. Is that too much to ask? The PAP test is the cheapest test in the country. HPV is a little bit more expensive, but it is affordable. You're going to be paying 600 rupees for a PAP test once in 3 years for 10 minutes, and you will be cervical cancer free, right? That's detecting it early. How else can it be 100% preventable? So this is for everybody in your family. Mothers, aunts, bhabis, sisters, anybody who's married, who's sexually active over the age of 30, please ask them to get their PAP test done. And below the age of 26, not yet sexually active, please look at getting a vaccination done. Okay? How else do we prevent it? We do the PAP tests, we do the vaccinations. What else do we do? We said it's a sexually transmitted infection, so we practice safe sex. You have to be conscious of safe sex, limit your sexual partners, and know about your sexual partner's history, right? It is up to you to decide whether you're a boy or a girl. It's up to you to take action about your own health. Don't expect anybody else to do it, right? Strengthen your immune system, foods that nourish the cervix. Of course, immune system and immunity, we talk about a lot these days. There's a lot going around. Please look at it about how you can strengthen your immune system. Quit smoking, stay in shape. These are two things that enhance immunity. Okay, always they say smokers have reduced immunity. If you're smoking, the chances of you getting the infection are more. There are multiple reasons. One of them is that it affects your immunity. Staying in shape is the same thing. Obesity affects your level of immunity. Do not ignore family history. See, carcinogens have a way of affecting the body. Not everybody who smokes is going to get lung cancer. But because your body reacts to the carcinogen in a particular way, if your family, there is a history of cancer, you need to be more careful. Just make sure that you're taking all the preventive care that needs to be taken. Keep an eye on symptoms. Get your screening done. Be safe. It's not even something that is so complicated. These are some of what we call cervix healthy diet, but they're just generally good diet. You can look at them and add them to your meals. You have things that are red, things that are yellow, things that are green, things like that. So they help in improving your immunity, specifically for the cervix. So make sure you have vitamin B, decrease stress, quit smoking. These are, I think, common things with cervical cancer, or I think with immunity also. So cervical cancer is preventable. You can create awareness. You can counsel people about it. cervical screening you can get done. You can ask others to get it done and get the vaccination done if you are in the vaccination state, right? This is the basic of cervical cancer, what it is about, how it can be prevented, what you can do about it, right? Anybody has any questions before I wind this up?
Ma'am, basically we have a Q&A round.
Okay.
Wherein we have floated a registration form for this event, and most of the participants have sent in some questions. So the anchors will be taking up the questions now.
Okay.
If you are done with your content.
Yeah, so then let me just close it.
Yeah, okay, ma'am.
So now that I've given you this, I want all of you to just think about how you can be a part of this conversation. What are the 3 points you need to keep in your hand that will help you talk about cervical cancer that you're comfortable doing? And for you to reflect on whether you think that it is important for you to get into this conversation, for anybody to get into this conversation. Will you have the courage to go home and ask your mom if she's got a pap test done? How many of you can do that?
Yes, ma'am.
You can?
Yes, ma'am.
Yes, ma'am.
You can ask your mom, you can ask your bhabhi. Yeah. So if you are comfortable saying this to your family, ask them if they know about a pap test, if they've gotten it done. An HPV DNA test, if you can afford it, is the best thing to do, right? In our country, it costs about between 16 to 1800 to get an HPV DNA test done. But that's a one time for the next 5 years. And over the age of 30, WHO now says if you are healthy and over the age of 30, 2 DNA tests in your life should be enough. Okay. Otherwise, we say you need to be tested till 65. And around 60, 65, if your last 3 tests have been negative, then you can stop screening. Otherwise, screening is important. Okay. So it's okay for you to know about it. The point is that I'm speaking to 87 people here, and I expect all 87 of you to get out there and speak to at least 100 people. Right? So this information is not for 87 people. It's for thousands of people. Correct? All of you are going to go out and speak to as many as you can. If you can do that, then it has been successful. Then it's a good thing to come and talk to you. It doesn't end with this conversation. Correct? And just to let you know, thank you, Aishwarya. Just to let you know that we also have an ambassador program that we do, where we have the youth to come in and learn from us on how to do these awareness sessions. For you to learn how to conduct them, public speaking, things like that, so that and get all the information that is needed, all the research material, so you can go out and do awareness sessions if you want to do them at length. If you want to just be able to speak about it and be an advocate for cervical cancer, then you just need to know a few basic points. Okay, for cervical cancer. And that is why we are here talking about cervical cancer. I'm happy to take any questions that you have for me now. Thank you.
Thank you, ma'am. That was indeed very informative and enlightening. I would now I would request the audience to ask their queries via chat box. Our questions will be sourced from the chat box as well as the registration forms.
Oh, so I have a question here that says, does cervical cancer vaccine also prevent the women from other kinds of vaginal infections? So HPV is known to have to cause vaginal cancer also at a very small percentage, I think about 20-something percentage of them. So it only prevents HPV infection. The cervical cancer vaccine is called the HPV vaccination. It prevents HPV infections. So not the other vaginal infections, not the other viral or fungal infections, but just HPV infection, yes. Thank you, Khyati.
Thank you, ma'am, for your answer. Now the next question that was asked, what are the risk factors for cervical cancer?
Okay. I have a question here as well. Pooja, give me a minute. Let me answer that. Risk factors I had put down when I was talking about it. I think I had explained the risk factors. So smoking, your sexual partners, unprotected sex. So when we say preventive, The same thing is actually a risk factor. Multiple sexual partners, no history of your sexual partners, no sexual preventions, health, smoking, all of these are risk factors for cervical cancer. Like I said, cervical cancer is an infection. Everything that can cause the infection and everything that is not going to be able to fight the infection is a risk factor. Okay?
Thank you, ma'am.
Slide to you again. I'll send the presentation to you if you need, and you can pick out those slides and share it with others. Pooja here has asked, as you told about HPV, at what age we can have it for preventing cervical cancer. So the HPV vaccination, I have told you, the HPV vaccination can be taken from the age of 9 to the age of 26 or before sexual debut. If you are till the age of 16, you can take it, you need 2 doses. If you are over the age of 16, you need 3 doses of the vaccination. That is preventive. Other than that, you need to get your screening done. Screening will be done over the age of 30. You can choose what modality of screening you want, but that would be over the age of 30. One minute. Anvi Gupta, you stated that maybe okay, so in our country, the positivity rate of cervical cancer is 16%. When we talk about eliminating, or in the West, it is 0.04%. In India, it is 16%. So yes, 72% of women are exposed to HPV. 16% is the positivity rate of cervical cancer. So that's what they say. About 70% women will actually wash it off naturally over time, or their immunity is so strong that it will not convert to cervical cancer. But you will see women at the age of 60, 65 getting cervical cancer. In our country, there is one peak that happens around 35, 40 and another peak that happens at 60, 65. Because women, when they come into their menopause stage, their immunity falls. When your whole menstrual cycle comes to an end and you start to menopause, your immunity falls. So you may have had the infection, but your immunity was so strong, it was containing the infection. The minute your immunity fell, the infection picked up. So 60 and 65 are not women who have just gotten the infection. It's somebody who's been holding the infection all this time, but their immunity has now fallen, right? So that is very important that you maintain your immunity, or you're aware of it. So you get yourself screened. Do you feel that the government should take up the initiative of cervical cancer to spread awareness at a mass level? So we are working with the government. Absolutely. It has to be done at a large scale, and no NGO or no asking the youth to support us is going to be able to create the kind of impact that we are looking for. Only through the government we can. So there was a whole lot of talk about the government putting the vaccination into the immunization schedule, that all children will be vaccinated just the way we get our BCGs and all. But that didn't happen because they said that India is still fighting TB and polio, and they don't want to get this vaccine into it now. Also, all said and done, women-related issues do take a back seat in our country. So the vaccine didn't get introduced. Screening is not available at grassroots level. There is a lot that needs to be done. And we are currently working at the center level to create some changes and to make them happen. There are some states that have done it. In Tamil Nadu, there is a screening program that is on, Vina Screen. In Sikkim, there is screening and vaccination. All girls are being vaccinated. In Punjab, there is work happening. So randomly, it's happening in the country, but as a whole, not yet. And yes, we need to do that. Absolutely, we need to get the government involved. And we are talking to them. Let's see how long it takes for that to happen.
This was very informative, ma'am. Thank you. Now I would like to present you the next question. A girl before marriage can be a patient of cervix cancer.
So it's not marriage anymore, Sanchita. It has to do with your sexual activity. If you are sexually active, you can have the HPV infection. Okay. Whether it will convert to cancer or not, you don't know yet. And if you are going to get it screened, if you are going to be healthy, if you're going to be hygiene, if you're going to follow menstrual hygiene, it may not convert to cancer, right? So if you are associating marriage with sexually active individual, then yes. Otherwise, we don't say marriage, we just say sexually active. So if you are sexually active, you need to be aware that you can be infected. You will be screened after the age of 30. So just make sure that you're healthy, hygienic, and aware.
Thank you so much, ma'am. The next question is, sometimes doctor do biopsy for cancer detection in vagina. Which one is the sure test for it with confirmed results?
Are you saying what is the sure test for cervical cancer? So vagina would not be cervical cancer. It would be vaginal cancer. And they will do a biopsy of the vagina if they have any reason to believe that there is a cancer there. Could be for HPV, could be for something else. A biopsy is the only thing that actually confirms cancer. So even if the ultrasound will show you, they will still do a biopsy. So biopsy is important. For cervical cancer, they will do an HPV DNA test on you. It's a screening. If that HPV test is positive, it is assumed that you have HPV, and they will then do a biopsy of the cervix to see if it has converted to cancer or not. So biopsy, colposcopy, these are important tests to confirm cancer.
Thank you so much, ma'am, for clearing our doubts. The next question is, can HPV transmit through the same sex relationship?
So, like AIDS transfers through body fluids, right? Through blood, through semen, through sputum. HPV transfers through skin contact. So even if it is same sex, if you are able to, if there is penetration and you can reach the cervix, whether it is with hand, whether it is with any skin contact, you can get an HPV infection. But repeated infection that lasts for like 10 years before it converts to cancer, that would depend on how much skin contact there is. So HPV is transferred by skin to skin contact, unlike other sexually transmitted infections that are transferred through body fluids. So skin contact can be same sex as well.
Okay, thank you, ma'am. So the next question is, can cancer be detected in ultrasound?
You know, sometimes it spreads so much that it becomes obvious in an ultrasound. So I have to tell you, very recently, a friend of mine, she was constantly having loose motions. Matlab, bar she would take medicines and she would be okay. And she kept saying it's because COVID na ghar pe baithe rehte. There's no exercise. I'm not going out, eating so much. She completely changed her diet and finally she said, I have to go and see a doctor. She saw a doctor, took antibiotics, kuch nahi hua. This had been 8 months. So he says, you need to get an ultrasound done. And in the ultrasound, it was so clear that the ultrasound said that she has metastasized. It was all over the ovaries, all over her abdomen. It was so clear in the ultrasound. But if it is a small little thing, it has just started, it's a small little tumor, a little growth, sometimes the ultrasound is not clear enough. It will be unspecific. Then they will want to do a biopsy and kind of confirm it. Sometimes if it spreads so much, yes, the ultrasound shows it. So I lost my mother to lung cancer. And hers, when they took her X-ray and whatever, they kept saying TB. For a long time, she was on TB medication. Kyunki nahi clearly dikha unko ki kya hai. Till the time they actually did a biopsy, and by then she was 4th stage of lung cancer. So sometimes it does, sometimes it doesn't. It depends on kitna phail gaya.
This was very informative, ma'am. Now I would like to put the next question. What is the best possible way to ensure menstrual hygiene?
So the biggest thing in this is to be aware, right? You need to be aware of what you have to do. Whether you are using a cup, whether you are using a pad, whatever you're using, you need to know what is the best way to maintain it, what needs to be done about it. You have to be very self-aware, and you have to be willing to talk and share about it, right? That is from where it starts. Without awareness, we are not going to be able to do anything. Correct? Then, of course, you have all your menstrual hygiene, not only for yourself, but also for the disposal of it, which we consider very important for cervical cancer also, right? How you keep yourself, how you wash, how you don't leave yourself wet. Even if you're going to wash it, you have to ensure that you're drying yourself, because that's how these things spread. Also, how are you disposing of the pad, or what are you doing with the cup? All of that would be part of ensuring that you have menstrual hygiene. I'm speaking from the viewpoint of cervical cancer, right? So all of this would go into creating and especially if you're not the only one using the washroom. If you are using a washroom and sharing it with a sister or sharing it with a partner or doing something like that, all of this becomes very important, right? Your hygiene in relation to cervical cancer, your menstrual hygiene.
Okay. Thank you, ma'am. This was very enlightening. The next question here is, will the treatment affect my ability to become pregnant in future? Should I talk with a fertility expert before starting the treatment?
Treatment for what?
I think maybe the person means HPV or the cancer is detected.
HPV infection, avoid getting
Maybe
pregnant.
the cancer is detected. Then
if cancer is detected, you're not going to get pregnant because they are going to be treating you, right? So you're going to be going through chemos or radiation or surgery or whatever it is. You're not getting pregnant then. Even if you have been detected with HPV, you're not getting pregnant. Ideally, they will tell you not to get pregnant, whoever is your doctor who is seeing you. If you're taking an HPV vaccine and you happen to get pregnant, don't take the next vaccine. You can complete it after the pregnancy and sometime after the pregnancy. So the vaccine is not a problem. Ideally, if you are planning to get pregnant, don't take the HPV vaccine. But otherwise, that's the only thing that is you can get pregnant while even in the middle of your vaccine schedule. But once it is cancer or once it has been detected with HPV, the doctor will suggest not to get pregnant.
Ma'am, I guess the participant would have asked that, are there any chances of not getting pregnant if once she has been diagnosed with this cancer? Like the chances of getting pregnant gets null.
So if they do a surgery, if the cancer has spread in the cervix and they do a surgery, then yes, it affects the uterus. Then it is a problem. Okay. But even if they do a radiation and things like that, then the chances can be affected, but that your gynae will tell you case by case. It depends on your particular case. So cancer of the reproductive organs will always have some effect on reproduction, but that would depend on that very case. Oh, wonderful, Aditya. I am so proud of you.
Thank you, ma'am.
Yeah. Should I be sure that ever in my life I'm going to be a patient of HPV, sweetheart? I told you 70% the vaccine protects you from the infection, but there is still 30% chance. So sometime after the age of 30, maybe around 40-ish, you need to get an HPV DNA test done. Just one test around that time, around the age of 40. Abhi bahut time hai, but around there, ek test to zarur kara lena. Because we say that the vaccine is 70% effective. So it's actually a technical thing. In India, we say that the two strains that affect India the most, the vaccine works on them. But still, statistical data, the data on paper says that the vaccine is 70% effective. You need to get a screening done somewhere down the line. So wo kara lena zarur.
Okay, thank you, ma'am.
Thank you so much, ma'am. It was very stimulating. The next question is, can radiography techniques of PET-CT can also be used to detect cervical cancer?
No, you won't know if it is cervical cancer through radiology. It could be any kind of cancer. Yes, if the cancer is spread, they will know that it is cancer. But it could be uterine, it could be vaginal, it could be any kind of a cancer. Is it an HPV cancer? Will only come by testing it for HPV.
Okay, ma'am. Thank you. I don't think we don't have any more questions left. So here we come to an end.
Okay. Anybody in the audience who has anything to ask that hasn't been put up there?
No, ma'am. All the questions in the chat box are already answered.
Wonderful.
One thing I want to ask.
Yeah.
How can I self-diagnose?
So you need to look out for symptoms. But again, I'm telling you that if you're looking out for symptoms, that means cancer ho gaya. I don't want you to get there. You don't have to diagnose for cancer at all. Everybody here, you should never have to self-diagnose for cancer. You should have done whatever needs to be done to avoid the cancer. But otherwise, yes, in your mother, sister, here, there, everybody else, what you are going to say is to know whether it's abnormal bleeding from your cycle. There is a discharge which is excessive and or foul smelling. There is pain during intercourse, immediately after intercourse. There is bleeding in between the cycle, right? It comes during menopause, yes. But now if there is bleeding in between the cycle, if you're spotting or immediately after intercourse, there is bleeding, all of these are symptoms that need to be checked. These are very early symptoms. What we say ki you have pain and you have weight loss and all, ye bahut baad mein aata hai. This is advanced cancer. Shuru mein, these are the things that will happen. There will be discharge, there will be abnormal bleeding, there will be pain. When you urinate, you might have pain. These common things, they will be your symptoms. But please, nobody should get there. None of you should have to see these symptoms. You know what you have to do to prevent it. You know what you need to do to not ever have these symptoms. I don't want any of you to ever have to self-diagnose it. ठीक है ना? Commitment. All 87 of you.
Yes, ma'am.
Yes, ma'am.
Thank you, ma'am.
Yes, no, ma'am.
Thank you, ma'am. Thank you so much, ma'am.
Thank you, everyone. It was really lovely. Shreya, what does that mean? Monotonous free matlab kya hua? I didn't understand.
Ma'am, if we want to connect.
Sorry. Kya? Somebody was saying something.
Ma'am, if we want to connect with you personally, so how can we connect? Like, can you share your Insta ID or something?
Me, I have no Insta ID. Capit has an Insta ID. If you want to leave a message for me on that, you can. I am otherwise on Facebook. And on LinkedIn, you'll find me by Mridu Gupta. But otherwise, I am Insta. I'm not an Insta person. My children would throw me out. They'll tell me, at least yahan to chhod do hame. So I'm not on Insta at all. I am on LinkedIn and I am on Facebook. And you can connect with me anytime. Otherwise, you can connect with Capit, and I think all of you should. We have all the latest information. We have little informative posts that you can share and you can, talk about. So you can be connected with us always on any of the platforms. Insta pe bhi hai, Capit is there. So for me, Sonal, anytime.
The session was really very informative, but I have just one last question for you. You just talked about the lung cancer. If the lung cancer is not detected in first biopsy and the doctor recommends the second biopsy for the same, what does it mean?
So sometimes the cancer hasn't spread enough. So where they have taken the biopsy from, that part of the lung that they have taken out hasn't shown any cancer cells, or they feel that it wasn't confirmatory enough. They will ask you to do one more biopsy in a different area, hoping that they will get a larger chunk of the cancerous cells. So that does happen very often because the biopsy is just taking a very small part of the organ. And it's possible that part of the organ hasn't picked up enough of the cancer for them to be able to study it. So they would ask for it. Ideally, a lung biopsy is not an easy thing. It's very painful. I remember my mom getting them and she had to get them, I think, twice because they were doing a different test on her. It's very painful. So hopefully they should get it in the first go. But agar enough material nahi milta, they ask you to do it and they change the location from where they are going to take out the cell.
Yes, ma'am. The thing is that in the PET CT and other tests, it is a strong suspicion in the lung cancer, but in the biopsy, the doctors are not able to find it out. So,
the second biopsy also they don't find it, then all is good. But if the PET scan is showing signs, then kahin na kahin to hoga in the lung. They'll just have to be able to locate it. The PET scan should have shown the exact location also.
Yes, ma'am. I don't know why.
So ठीक से नहीं, must have not gotten enough of a chunk. That means it hasn't spread so much. It's in a particular area and they haven't been able to get the exact chunk that should show the cancer. The second biopsy, they'll have a better idea maybe because.
So now I would like to request all the participants to please switch on your cameras for a group photograph. After such an informative session, this photograph is a must.
Yes.
So I request each one of you to please switch on your cameras, if possible.
Thank you.
And you can write your views and feedback in the feedback form that will be floated. So kindly wait.
Please share the feedback with us also.
Yeah, sure, ma'am. We'll share that with you. So a feedback form will be floated in a while. You need to fill that and you'll get a certificate of attendance.
Oh.
So yeah.
So how many of you were here for the certificate and how many of you were here because you wanted to know about cervical cancer? You know? I'm sure this is Adat over here only for the certificate. Did you all get anything out of it?
So ma'am,
Yes,
there were
ma'am, we
actually
did.
a lot of boys. Us being a girls' college, we have managed to spread this message to as many as possible. And there were a lot of boys who get connected through this webinar. And yeah, that must have been informative for them as well.
So happy. And we always, I just assumed that you were a women's college, so there would be women. I didn't check with you. But otherwise, yes, it's very important that we get men into the conversation. So if you go on our Twitter, we actually had a drive this month. So January is Cervical Cancer Awareness Month. Everything is teal in January. So if you go, we've actually had a drive that says men to end cervical cancer. We're trying to create a campaign around men to end cervical cancer. So I'm very happy there were men today. Good. अच्छा, photograph लेनी है?
हाँ जी ma'am. So everybody please switch on your cameras and say cheese because it's the end of the event. We host many such events, so stay connected with us through Instagram or any of our social media handles. We'll be sharing them in the chat box real soon.
Very good.
Is the photograph done?
Thank you. Thank you, Menstrual Cafe. Thank you everyone who was here. It was a very productive session. Thank you so much.
Thank you so much, ma'am. So I would like to call Rishba Arora, the editorial head of Menstrual Cafe, to give the vote of thanks to Ms. Mridu Gupta and the amazing audience.
Thank you. So it is a huge privilege for me to be able to deliver the vote of thanks to such exceptional people today. Firstly, I would like to present my heartfelt gratitude to our special guest, Dr. Daya, the conventree of our initiative, for her constant guidance. Moreover, I thank our amazing faculty and the team of Sachi Saheli, the NGO which has introduced the concept of Menstrual Cafe in several educational institutions and has always backed us. I would also like to thank Ms. Mridu Gupta from the bottom of my heart. Thank you so much, ma'am, for taking out your time for us from your busy schedule. I am utterly grateful to the Menstrual Cafe of our college. Last but not the least, I thank our wonderful audience for taking out the time for this and joining us. Hope we all were able to learn from this and would have something knowledgeable to take further in life. Finally, I leave you with an inspiring quote, which is also our motto. Our vision is to create a world where menstruation holds no one back. We fight for menstrual freedom. We fight for those who bleed. Thank you. Thank you so much, everyone. Thank you, ma'am.
Thank you, Rishpa. Thank you, everybody. Thank you, Menstrual Cafe. Bye.
Thank you, ma'am.
Thank you, ma'am.
Ma'am, we hope to host more such events with Caped India in future.
Yes.
Menstrual Cafe will definitely connect with your organization for future events.
Thank you.
It was great having you and hosting you. Thank you so much for taking out time for our event. Because there was an house full. It was an house full event, right? Everyone was there. So thank you so much, participants. The feedback forms link is there in the chat box. You can go and fill the feedback form and get your certificates mailed to you. You need not have to do anything. You just need to fill the feedback form. Your certificates will be mailed to you in your email address. So kindly provide your name and college name as per you want it in the chat box, in the certificate, I'm sorry. Kindly add your name and college name as you want to be printed in the certificate.